Good morning, everyone, or afternoon if you're on the East Coast. I'm Kevin Bradford, the Research and Writing Support Librarian at Philadelphia College of Osteopathic Medicine here on the Georgia campus in Metro Atlanta. Guess I can start from here. Oops, sorry about that. All right, let me just try to move that out of the way. Maybe just click OK and it'll go away. There we go. Okay, sorry about that shuffling around. So before we get started, we want to go over the objectives. So for our brief conversation today, we're basically just going to get our feet wet, so to speak, on what inclusive writing means and what it's for, and to understand and practice the best practices for writing about topics such as race and ethnicity, sex and gender, sexual orientation, and disability within the health sciences and medicine context. And the third objective is to know how to apply these inclusive practices in a medical and health sciences context. Basically, essentially, one of the most common routes that this would take would be you're taking material from a case report or a patient encounter, and then eventually that will find its way into the published record. If you're writing a journal article and such. So rather than read you this whole slide, I'll just give a real brief um, kind of an introduction into what inclusive language is. It's a subset of cultural humility, which was a term first coined way back in 1988 by a couple of faculty at the University of California, Davis. So inclusive language acknowledges diversity, conveys respect to all, is sensitive to differences in people, and promotes equitable opportunities for all. So this refers to language used in emails. I'd already mentioned patient notes, patient encounter notes, case reports, but it goes down to the prosaic everyday email and marketing materials, social media, websites, and any other type of form of communication. So all of your written work, no matter what form or origin that it may come from, should be free from words, phrases, or tones that demean, insult, or exclude people based on their membership within a certain group or due to a particular attribute that a person or people may possess. So language, of course, is fluid, as we all know. Um, the meaning and connotations of words can change rapidly. So descriptive terms, words used to describe persons and people have indeed changed rapidly. When you think back to from the 60s, even as recently as the 90s, the O's and the 10s, contexts change, meanings have changed, interpretations have changed for old terms. And I'll give you some specifics as we go forward. So you don't necessarily have to learn specific phrases. Uh, and we all have to do our best with this uh, because the landscape changes constantly. And I've got some references at the end of the presentation, and I'll point out the AMAs in particular, the AMA guide in particular. So the number one rule, most important rule, um, so if a person is self-describing themselves, an aspect of their identity, could be their sexuality, race, or gender, use the identification that the individual has stated about themselves rather than trying to apply your own interpretation. So again, I'd mentioned, where does this begin? In the healthcare context, which is what we're most concerned with here, is it could begin with the patient record, and end up in a journal publication draft, for instance. Um, so constructions or terms within this context typically start with the phrase people with or people living with. And I've got a list of examples here. People living with depression, not depressed people. People diagnosed with cancer, not cancer patients. People with asthma, not asthmatics. People who use wheelchairs, not wheelchair-bound people. Older people, not the elderly. And I do see this a lot as the writing specialist here at PCOM. You wouldn't have naturally thought that the elderly is necessarily non-PC nowadays. This is how quickly things change. Young people, not the youth, because a lot of these terms and quotes, the original terms, they're kind of loaded terms, so to speak. They tend to be cliche. They tend to indicate a bias. I think one of the more common ones I think that we have heard, particularly if you're listening to like say for instance NPR or reading articles, you'll see people experiencing homelessness quite a bit, not homeless people. People with low income is another example, not low income people. We want to avoid categorizing people and victimizing them. So this is basically a summary of these various terms. Is we don't want to uh, use pejorative terms, victimization terms. So general guidelines is look for ways to integrate equality and inclusion in diverse populations into these written materials. Don't use offensive or derogatory terms. Now that seems common sense, but again, things have changed. Terms could be such as Indian giver, Gyp, Jude, Oriental. And I have a personal confession here to make, particularly on the term Oriental. I didn't really realize until maybe 3, 4 years ago that Oriental was not to be used anymore. We want to drive into specifics rather than general sorts of descriptors. And I'll give some examples of the specifics. So in general, if there's one thing that you cull from this presentation is be as specific as possible and avoid the generalities. And of course, outdated terms, crippled, that's another term we don't use, or overly clinical or medicalized terminology such as homosexual. Again, here I mentioned the AMA guide, and I'll show you the link to that. The AMA guide is a living document, and I would say it's very specific. And of course, it, like everything else in terms of equity and inclusion, is constantly changing, constantly revised. Uh, Terminology that relates to race, gender, sexual orientation, religion, immigration, or veteran status can overly adversely emphasize an identity, feed stereotypes, or really be outright discrimination. So everything is related to context here. For instance, would you include a characteristic or identity of any group normally, usually? What is being accomplished by noting a characteristic or identity of someone? Would you use the term black professor or heterosexual musician in this specific context? Generally speaking, no. Those terms would be considered pejorative, essentially, and certainly not inclusive. So I mentioned earlier, be as specific as possible, but another way to look at that is focus on the person, not their identity. And here's a couple of examples. A baby with Down syndrome, not a Downs baby. A person living on a subsistence level income instead of Jane Doe is low income. Um, we want to avoid victimization terminologies, and no one who is, say, if a patient, consider yourself when you go into visit a doctor's office, you don't want yourself described as a victim. You're not a victim. You're a person. You're a human being seeking help. And I highlighted that in red. And here's some phrases which tend toward victim language: afflicted with, struggles with, lives with an issue, or has a particular issue. The phrase battling with or fighting cancer, In a formal context, that implies victimhood or weakness, but you see this all the time, and people necessarily don't have a negative intent or bad intent when they write that. Usually, a person who has passed from uh, cancer, you will see that often in memorials or in notes of sympathy, battling with or fighting cancer. Uh, so it's fairly common, but try to avoid using that. And in terms of specifics that I had mentioned or a couple minutes back, here's some other examples to describe people that is specific. Chinese rather than Asian, Guatemalan instead of Hispanic, because the Hispanic culture is wide and expansive geographically, historically, and socially. So we want to try to get to the bottom of the specifics for identity purposes. Again, with LGBTQIA, you see that acronym all the time. But when you're talking about individual people within that larger group, focus on the specifics. Who are you talking with in particular? And of course, when in doubt, ask the person how they want to be identified, which includes, of course, what pronouns they prefer. Consult with a style guide, and the AMA is not the only style guide. There's some general style guides as well that can help you with that. Make room for a person's complex identity and the complexity of different communities. For example, you might have multiple identities of the individuals that you're describing or working with. A veteran who uses a wheelchair, disabled vet, may also be part of the LGBTQIA community. Muslims, Latinos, and Jews may be from many different races, ethnicities, or geographic origins. So you want to weigh the use of a general and a specific terms when referencing places of worship so as not to exclude any group or perspective. Be specific when the instance requires, and I would say be specific in almost all instances. Um, when discussing religious buildings or institutions in general, use a term such as a place of worship or house of prayer. If original religion is specified and appropriate in this case, in the case you're using, use a particular term such as a mosque, synagogue, etc. Also, we're talking about differences in uh, individual holidays, specific cultural or religious holidays. Use a specific term. And here is Christmas and Rosh Hashanah as a couple of examples of that. Again, with race and ethnicity, again, the general rule is be specific. Guidelines can help with that. Uh, don't actually mention race or ethnicity unless there's a concrete reason for doing so, and make sure that reason is clear. And in particular, in a health context, certain races or ethnicities may be prone to uh, having certain medical conditions that aren't necessarily found in um, other races or other ethnic groups. I think of sickle cell anemia as one particular example of that. So race refers to a category of humankind that shares certain distinctive physical traits, being human, whereas ethnicity refers to groups of people classed according to common national, tribal, or religious origins, or language, cultural origins, or backgrounds. So, moving on to sex and gender, you want to make your content gender neutral as far as possible, and avoid gender specific terms, the traditional terms masculine and feminine, in terms of their pronouns, he and she. Instead, use you where appropriate, and sometimes they. Uh, they, in particular, is not a new way to describe these differences. Oops, I'm sorry, I want to get rid of that. So I'm going to pull. Okay, there we go. So, gender is often confused with sex, but these terms describe two different things. Sex is the biological characteristic of males, females, and intersex folks. However, gender is on the spectrum. It's cultural indicators of someone's personality and social identity. You want to also consider how specific you need to be. In other words, specify sex where it's relevant. And of course, it's not always relevant. Um, and again, outside of research, you want to choose sex neutral terms that avoid bias. Opt for using the term people more often than men or women. You might refer to people with a cervix or people with a prostate gland. And why is that so? It's a consideration for non binary and transgender folks who might need specific types of health services. So, an example on the bottom, you want to avoid the disease threatens mankind and use the disease threatens humankind. This is not, uh, humankind is not a new construct either, a new way of describing persons. It's been around for a while, and I typically, and you probably do in your reading, see humankind mentioned more than mankind. So again, with sexual orientation, only indicate in your reports and writing orientation when it's scientifically or medically relevant. When you're referring to specific groups, the terms lesbian and gay men are preferred to homosexuals, which is far too generic. Also, avoid using gay or gays as a noun. You can use heterosexual, homosexual, bisexual, and intersex, etc., as adjectives. Uh, an example for that would be heterosexual men. So you want to avoid the researcher collected surveys from homosexuals, and then you want to drill into some specifics as preferred. These surveys were from lesbians or gay men. Personal pronouns. This, of course, is an um, evolving area, but it's been around a while in academia. It tends not to be personal pronouns tend not to be well accepted per se in the general community. But as health sciences professionals, we should be well versed in using personal pronouns and being comfortable with that. Again, avoid using common gender pronouns such as she, he. They and them as a singular form are becoming more commonly used. In fact, I do see that almost universally. You can also reword it to use pronouns that aren't sex specific. Um, and I've got a couple examples at the bottom of the bottom of the screen. Uh, avoid the physician and his resident perform the surgery because physicians aren't always male, as we know. The a better term would be the physician and resident perform the surgery. This avoids uh, any gender or sexual identity concerns. Age is another interesting descriptor here. Um, and only include age if it is relevant. For example, with vaccination schedules, screening or testing programs for particular age groups. Uh, Adages like these old cliches, you can't teach an old dog new tricks and senior moment. Well, obviously, those are, red flag stereotypes. Uh, and it implies and stereotypes individuals uh, as unhealthy or in mental decline. Ageism is discrimination, plain and simple. What we want to do in health sciences descriptions and formal writing is it's better to state specific ages or age groups, numerology, in other words. Age group uh, 0 to 5, age group children 6 to 12, etc., and so forth. So you want to avoid comparing the effects of drugs on elderly patients and phrase it in that way. And to switch that around to be inclusive is to say the study compared the effects of the drug on patients 65 years and older. Numerology. Um, Young children, avoid that and you can swap it out for the specifics of age, such as children between 2 and 6. And socioeconomic status is also an area where there will be bias and discrimination. Rather than using terms like poor and unemployed, use low income or no income. Avoid using we determine mortality rates in the poor. And you want to substitute for that for something like we determine mortality rates in persons from low income households. And of course, when you're talking, just informal communication, where you're chatting with someone, talking with someone, it's very easy to slip into describing people, as groups in the poor. And no one is perfect, myself included, even though I'm a writing specialist. But try the best you can. We all do make mistakes. So more specifically, I'm not going to go through all of these descriptors and examples about labeling, but as in the health sciences, again, we want to be more as specific as possible. So labeling, general descriptives are to be avoided, and in general, you want to be as explicit as descriptive as possible. Again, you want to avoid describing persons as victims or other emotional terms that suggest helplessness. Uh, one of the most common in terms of, say, for instance, for forensic psychology, is describing a person as a rape victim. And a common substitute with that would be a person who has experienced a rape. Okay, here's some general resources on stylization, diversity, progressives, radical copy editor. So if you're doing writing in particular, that'll be useful for you. Resources for race and ethnicity language. And in terms of the LGBT community, they have some guides for styles and writing styles in that community, that group. Disability language. I want to bring your attention to the second resource, the AMA Health Equity Guide. And then the National Center on Disability and Journalism. And that is it. I've tried to be as concise as possible, and I certainly recommend that you go back through the recording for more specifics. But right now, I'm going to open this presentation to any questions and stop sharing.
Please feel free to unmute yourself if you wish to ask a question or type it in the chat.
Well, I thank you folks for attending. I appreciate the fact that you're interested in this timely and really critically important topic. And again, I would like to emphasize, don't worry. We all make mistakes. Hopefully, these references will help you become more proficient at how to write inclusive and respectful language. Oh, Andrea has a question.
Hi, sorry. No, actually, I was just clapping my hands to say thank you.
Oh, well, thank you very much. Thank you for the thank you. Anybody else before we close?
Yes, we appreciate you all for joining us. You will receive a link for a survey later on, and here is the information in the chat on our next presentation. Oops, I didn't change the title. It's on COVIDence. It's on COVIDence.
Right.
Sorry,
Okay.
it's not yours again. It's I somehow didn't change the title, but the date and time are correct and the link is correct.
Yes, and
Um,
that's also on it will be in the recording as well. It's one of the slides here.
okay, yes, yes. Um, yeah, thank you for the presentation. It's always, like you said, it's always evolving, so it's always important to keep up to date on it.
Yes. Thanks,
So,
everybody. Have a good afternoon and the rest of your morning. I think it's still morning in California, right?
for another 30 some odd minutes.
Okay, great.
All
Have a great one.
right. Bye, everyone.
Bye.